Gibson Kohli here with Snackable Health. A lot of people out there on fish oil. A lot of contradictory data out there, Pyle. How do you make sense of all of it? We had some new data here at the heart meeting.
Yes, the new data keeps adding to our armamentarium of knowledge. But Mike, I'm de-escalating my patients that are taking over-the-counter fish oils because we know that over-the-counter fish oils have not been shown in cardiovascular outcomes trials to reduce your risk. They can have mixed components, and then that can actually adversely affect your cholesterol. They have risks like atrial fibrillation, which is a heart arrhythmia. They can increase your risk of bleeding. They're prone to spoilage. So if you're just getting a Costco brand or some other brand over the counter fish oil, it's probably a good idea to stop it or at least talk to your doctor about whether you should stop it. But really, what we looked at here at the heart meeting today was EPA, which is one of the components of fish oil. So
And this is not over the counter stuff. This is high grade, pure EPA that you would get from your doctor by prescription.
exactly right.
Mm.
And so when you have fish oils, they have, like I said, 70 different components, DHA, EPA, and something called ALA, amongst other types of oils. So this is purifying just that EPA, which we think is the biologically beneficial fish oil, and giving it to people who already have heart disease, and then trying to see whether or not we can reduce the risk of, having further events and such. And this was studied in a Japanese population, and fish oils come from fish. And in Japan, they eat a lot of fish. So their levels of EPA tend to be higher than they are here in America, where we have a little bit more of a processed diet, a diet with less fish. But even in that population, it didn't appear to show statistically significant benefit, although there was a suggestion that it could work. So, I'm very curious. There are many reasons for why that is. But personally, I have not given up on EPA, prescription EPA, as a way to treat my patients to reduce their risk. But I think it really needs to be something we personalize in the right patient, to achieve the right outcome. What do you think?
Yeah, I think the Japanese study presented here is interesting. They used a lower dose than what we use. They use 1.8 grams a day instead of the full 4 grams that we use here in the US. So lower dose. Of course, they have higher levels
Mhm,
eating all the fish they do.
mhm,
But interestingly, in their study, they only enrolled people who had low levels at baseline of
mhm.
EPA. So, and I was somewhat compelled by some of the other things they looked at, like sudden death and stroke and heart attack and revascularization. I found it a little more positive. So, I think it does build upon what we saw and reduce it. So, I think the prescription pure EPA, I think it may be a benefit.
So somebody listening out there, should everybody go talk to their doctor about a prescription EPA, or who would you tell which patients to talk to their doctors?
I think if you're someone who's on a statin already and have heart disease, and if you have high triglycerides, for instance, or you keep having events, and that would be the kind of person. I mean, who would you?
Yep, I would say that population, but also diabetics with high triglycerides. So even if you don't yet have heart disease because you haven't had a heart attack or a stroke, but you're diabetic and you have high triglycerides, that is also a population that's shown to have benefit in these trials. So
Yeah. But again, over the counter stuff, not so
get rid
much.
of it.
All right. Thanks, Pam. Thanks to all of you out there for joining us here at Snackable Health.